You recognize.
Dr. Gearhardt, thank you so much for your testimony. I am a clinical psychologist myself, so it's always wonderful to see another clinical psychologist. And I was heartened to hear about your firsthand experience working with those who are struggling with life-threatening health conditions. As we talk about access to nutritious foods and their role in preventing and treating chronic illness, I'm especially concerned about how this issue is impacting our nation's seniors. Roughly 7 million older adults are struggling with food insecurity, which ultimately leads to poorer health outcomes, lower nutrition intakes, and mental health issues, including eating disorders. While eating disorders are often thought of as a young person's disease, eating disorders in older adults have a mortality rate of over 20%. If left untreated, eating disorders can lead to heart failure, diabetes, and other serious chronic illnesses. That's why I've introduced a bill with Congressmember Fitzpatrick called the Nutrition Care Act, which would finally provide medical nutrition therapy services for individuals diagnosed with an eating disorder in Medicare. Medical nutrition therapy is an evidence-based medical approach to treating chronic conditions through an individualized plan, but the service is not covered under Medicare for eating disorders treatment. Dr. Gearhardt, given the rising concerns about over-processed foods and their impact on chronic illness, how can medical nutrition therapy help to ensure that seniors on Medicare receive adequate nutrition to support long-term health and well-being?
Thank you for bringing up this really important issue. Eating disorders are often very overlooked broadly, despite them having some of the highest mortality of any mental health conditions. And overwhelmingly, when we look at eating disorders, the sorts of foods that seem to trigger this loss of control over intake and intense cravings are these ultra-processed foods, that overwhelmingly these are the sorts of foods that people binge on and crave irresistibly. And often when we can actually nourish people and help them reconnect with food and also their body by helping them realize what it feels like to feel full and to feel nourished by the sort of real minimally processed foods we're talking about today, that can make a big difference. We did a poll with the Institute for Healthy Policy and Innovation at the University of Michigan with a nationally representative sample of older adults. And looking at that addictive profile of having that addictive relationship with ultra-processed foods, we found that 1 out of every 4 women 55 and older would have met the diagnosis of an addiction if that substance was an ultra-processed food. This was associated with worse physical and mental health and social isolation. So I think the more we can get our older adults access to healthy, nutritious food in a convenient, affordable way will really benefit us across multiple domains. And we've referenced here today dementia, Alzheimer's. I don't think we've fully seen the consequences of our diet on our cognitive well-being, because it's only my generation that's lived their whole life in a predominantly ultra-processed food environment. And so I think this is going to continue to grow as we age into older and older cohorts, unless we do something now to address our food environment.
Thank you for that. Dr. Gearhardt, I also want to highlight the rise of another chronic illness, addiction and substance use disorder. This crisis is worsening like other chronic illnesses, and it's a long-term condition that requires ongoing management and takes an extreme toll on physical and mental health. As we discuss strategies to combat chronic disease development, it's critical that we help leverage social support systems such as friends, families, and peer groups to encourage and maintain healthier behaviors. And that's why I've worked with my colleague on this committee, Congressmember Adrian Smith, to introduce the Peers in Medicare Act. A peer support specialist is a person with lived experience who's been trained to support those who struggle with mental health, psychological trauma, or substance abuse. And they supplement mental health professionals as part of the care team struggling with substance abuse or mental health disorders. Our bill would require Medicare to cover peer support services at rural health clinics, federally qualified health centers, community mental health centers, and certified community behavioral health clinics. Dr. Gearhardt, can you say something about the utilization of these kinds of specialists, peers who can help individuals better manage their mental and physical health conditions?
Absolutely. I've had the opportunity to treat individuals with substance use disorders, particularly at the VA hospital in Ann Arbor. And I can't tell you how essential peer-led support groups that have really flourished in the context of addictive treatment, like 12-step programs, can play such an essential role. We see that behavior change is really more effective when it's supported by other people and you feel like you're part of a group and a social network who supports you. These sorts of mental health conditions aren't just short-term. They're often lifelong changes. And we don't have enough mental health care providers in the United States, particularly in rural areas, to provide the sort of chronic care that is needed to help people sustain these behavioral changes. Peer supports can help people connect to others who understand what they're going through, reduce stigma, and promote lifelong change in a way that's affordable and accessible, and especially areas that are underserved by mental health professionals.
Thank you. I yield back.